Hi, this is Dr. Jack Wolfson, the Paleo Cardiologist, and today I want to talk to you about the markers you need to determine your heart risk. Much more important than total cholesterol, we're going to talk about the advanced cardiac markers that you need and how you can get those. What I have for you today is something called Beyond the 1970s cholesterol testing. And if we look at this page here, this is from a lab testing company called Vibrant America, but there are other companies that do this as well. But you need to get this information into your hands to be able to learn your heart risk and then get on a plan and then retest these markers down the road. So the top panel here that you can see with me circling with my mouse, this is the 1970s panel. When my father was a cardiologist back in the 1970s, total cholesterol, LDL, HDL, and triglycerides. This is the 1970s information. But in reality, total cholesterol is actually a very poor marker of mortality risk and cardiovascular risk. LDL, same thing. HDL is a decent marker. The higher the HDL, the better. But that being said, there's a quality of HDLs that you need to learn that information as well. And then also on this is triglycerides, and the lower the triglycerides, the lower your risk. So now we get into the middle panel, and this is what really matters here when it comes to overall assessment of having a heart attack, and that is this ApoB, ApoA ratio. So you look at ApoAs, which are mostly found on HDLs. You look at ApoBs that are mostly found on LDLs, VLDLs, IDLs, and you come up with the ratio. And the lower the ratio of ApoBs to ApoAs, the better. Once again, the less ApoBs, higher ApoAs, and there are strategies to do that, and your holistic doctor can help you figure that out. And if you watch some of my other videos, you'll be able to find that information as well. So the lower the better on that. That is the most predictive cardiac risk factor that we know of. And then finally, at the bottom of this, we look at small dense LDLs. The lower the small dense LDLs, the better. And then Lp(a) is a nasty type of LDL particle. It is genetically linked, so people do have a family history of that. It can be hard to modify, but I'm telling you, I've seen so many patients achieve better results with my protocol, and we're really making a difference as far as lowering Lp(a). And once again, I have a lot of blog posts on Lp(a), and I discuss it in my book as well. So once again, this is the information you need to determine your cardiovascular risk. Stay tuned for more videos where we're going to be talking about more of the critical information as it pertains to heart health that you need. And if you like this video, please subscribe to our channel on the button down below.